Good afternoon, ladies and gentlemen. Thank you all very much for joining us at our second in the series of our COVID-19 webinar updates. My name's Will Olstein, and I'm going to be hosting this for the next hour or so. I'm delighted to be joined this afternoon by Amelia Brovey, UK Head of Data Products, and our special guest today, really exciting to have her as part of the team, is Sarah Jones, who is from our academic partner, Imperial College London, and she is part of the Institute for Global Health Innovation. I'd like to just allow both Amelia and Sarah to introduce themselves before we go a little bit further. Amelia.
Hello. So as Will said, I'm Amelia and I'm head of data products here in the UK. So I know quite a few of our clients have signed up for our webinar today. So really hope that you get a lot of value out of it, and absolutely available to talk to you about anything in here afterwards as well.
Thank you very much, Amelia. Sarah, do you want to introduce yourself?
Hi, I'm Sarah Jones. I am a PhD at the Institute for Global Health Innovation at Imperial College London. And the co-directors of the Institute are David Nabarro, who is the World Health Organization COVID-19 Special Envoy, as well as Professor Lord Aradarzi, who is the former UK Health Minister. I'm looking forward to working with YouGov on this very, very important project. And you'll hear more about that partnership a bit later.
Fantastic. Thank you very much, Sarah and Amelia. Before we go any further, a little bit of housekeeping. We are on voice only for this call, just to preserve bandwidth, as we're all working remotely. If you do have any questions, please use the chat functionality in Zoom. You'll send that to all the panelists. We can review that as we go, and we'll try to come back and answer as many of them as possible at the end of the session. If we don't get round to it, we'll respond to you in writing afterwards. We are recording this webinar so that we can share this with a wider audience afterwards, and copies of the slides will also be available after we have finished. But let's crack on. So over the next hour or so, what are you going to hear about? Well, from me, what you're going to hear is about the work that YouGov is doing in response to COVID-19 and what our priorities are as a business at the moment. From Sarah, what you're going to hear is some real insight into how the scientists are thinking about COVID-19. She's going to look at some of the global aspects, as well as what are the models for nudging behavior. Then Amelia is going to look at, or has taken a look at, the UK data from our COVID-19 consumer monitor in the UK. She's pulled out some insights. We'll give you the story that's bang up to date. I'm going to come back at the end and give a slightly wider perspective, leaning on some of the other YouGov data that we have in our connected data set, and then we'll wrap up with questions from the floor. So first of all, let's talk about what YouGov's priorities are right now as a business. And Stefan, our CEO, has been absolutely crystal clear about this. Our business right now is about serving the public good. We are conducting tracking across 26 markets across the world, and a lot of that data we are making publicly available, both through our website and through media partnerships. The idea being that we can put data into the hands of the populations so that they can be better informed about the current situation. But we are also, and as the reason that we have Sarah with us on the call today, is our partnership with Imperial College and other public health organizations around the world. Not only are we supplying those organizations with our consumer monitor, but yesterday we launched a public health compliance monitor, looking at the understanding of and the actions that consumers are taking around the world following government advice. The first batch of that data was actually delivered to Imperial in the last hour. And we're really excited about what's or how Imperial can use that. More to come on that from Sarah. We do have a commercial offer, and that is very much to support our priority. We've got both syndicated and bespoke data solutions. They go into greater depth than the public data that is out there, but it is priced incredibly competitively and is there to help support us fund the public work that we are doing. And that's as much of a sell as you're going to get from me. What I'd like to talk about is our public data. So you'll find it on our website, and we've spent quite a bit of time and technology working on making this available to all and understandable to all. We track in there across 26 markets. You can look at filters by that. It's updated as and when we get data in. So the example that I'm showing on screen at the moment is a snip from our website showing data up to the 1st of April. If you'd like to view where that data is, the link is there on screen. And the 26 markets that we're covering are all the way from the US and Mexico through to extensive coverage of the APAC region and Australia. For our existing data products clients, so those of you that subscribe to Profiles and Brand Index, we've also used a lot of this data to enhance your subscriptions and those products. So in all Brand Index markets, you will find new filters. And in your Profiles data set, you will find in topical questions the public data that we are pushing out globally. So that's hopefully, as you can see, a bit of way that we can add value to our clients and our current subscribers. But what I'd like to do, and what I'm very excited to do, is hand over to Sarah Jones of the Institute of Global Health to give you some real insight into what the scientific community is thinking. Sarah.
Will, thank you very much. I'm Sarah Jones. I'm joining you from central London today. Very early on in this crisis, Stephen Shakespeare and Marcus Roberts at YouGov reached out to me to ask how YouGov could help researchers. The result of those discussions, that there is a whole company YouGov effort for the public good, which has far outstripped my reasonable expectations. YouGov is very kindly donating a considerable amount of their time and resources, not only here in the UK, but in dozens of countries around the world. From the research community to YouGov and to all of those working at the company tirelessly in this effort, I want to first say thank you. Your efforts are of enormous value to researchers and policymakers worldwide. My research area is consumer health behavior and developing and testing ways of positively impacting people's attitudes and their behavior through messaging and corporate programs. One of my particular areas of interest is mental health, and I have the privilege of working on my PhD at Imperial College under Ara Darzi, the former health minister of the UK, as well as Professor Hutan Ashrafian. Now, this morning I took the decision to remove the graphs about the spread of the COVID-19 illness that now come to all of us daily from the Johns Hopkins dashboard. Those are the very same figures that you have all been glued to now for some time. Now, very briefly, global cases passed the 1 million mark yesterday. Deaths from COVID-19 related illness are highest in Italy, Spain, France, and Iran, and the UK sadly has now had 2,291 deaths. What is a case of COVID-19? Colleagues at The Lancet published a very useful stratification of what constitutes a case of COVID-19. At the top of the pyramid, those meeting the World Health Organization case criteria for severe or critical cases are likely to be identified in a hospital setting, presenting with atypical viral pneumonia. Many more cases be symptomatic, for example, with fever, cough, but might not require hospitalization. Cases are being identified through hospital reports linked to international travel and through contact tracing of contacts of confirmed cases. The bottom of the pyramid represents mild and asymptomatic cases. These cases might be identified through contact tracing and as testing widens via testing for antibodies or genetic material from the virus. There is, however, a growing recognition of the importance of these unreported, untested, asymptomatic or mild cases, and a growing concern that these so-called super spreader events must be avoided.
What YouGov has done, as Will talked about at the beginning, is we've looked at how we can use our panel to really help understand how people are responding to COVID-19 and how behaviours are changing as a result of what people are learning about COVID-19. When we go through the data, we've got 3 waves of data from the UK. The biggest kind of takeout for me is how quickly consumer or our behaviour can change in a 2-week period. I think we spend so much time in our regular day jobs talking about how we can change people's behaviour and how we can get people to think and feel different things. And what we're going to talk through now shows that massive behavioural difference can actually happen in a really short amount of time. And it is really interesting when we dive into how different groups of people are responding to actually see how that behavioural change is speeding up in certain groups and how other groups it's still lagging behind. So I'm going to go through 3 waves of the consumer monitor data. So we started on the 12th of March, 19th and 26th, and we're looking at around 2,000 panelists per wave. So we've got, just over 6,000 panelists who have responded to this tracker now. As we go through this, anything that's a statistically significant difference wave to wave is indicated by an up or a down arrow. And at this point in time, we're continuing the tracker until the 30th of April, when the tracker will evolve. And I think that's one of our key takeaways from this is that the situation is changing really quickly. So when we first started the COVID-19 monitor in APAC, the first question we had on the monitor was, are you aware of coronavirus and of the COVID-19 virus? Having that question included in the monitor now just really seems redundant. So we did include it this week, and awareness was practically at 100%, but going forward, we've decided to take that question out of the survey. So what have we learned? So what we've seen from the first week of the tracker to where we are now is that the balance of concern has really shifted. And we now see that the majority of the population say that they are scared or concerned about catching the virus. That change has happened really quickly. And when we then start to actually look at how that has changed by groups, we can see some stories emerging. So we can see that females have been consistently more concerned about contracting the virus than males. And that has been since we started tracking this data in the 12th of March. And the distance between the two has stayed fairly consistent throughout those 3 waves of data. But it's only really been this week that we've seen males actually move into the net concerned group, or saying that overall there's more males who are concerned about catching the virus than males who are not concerned about catching the virus. As you might expect, the information and communication that has come out about who could be most severely impacted by the virus, older people are the most concerned age group, with younger age groups really only recently responding as net scared, or having more people within that age group who were scared about catching the virus than people who weren't. So I think that change from the first week of the tracker to where we are now is quite significant, and is a really good grounding when we come into looking at how people's behaviours change, to understand that as a whole, we're really coming at this from a different place than we were 2 weeks ago. So while we do see that males as a group are net scared, we are still seeing that young males are not exhibiting as much concern about contracting the virus as the population is overall. you know, when we see that there's this real connection between the level of concern people have about catching the virus and then the actions that they're taking to ensure that they don't, this is a concern, because if this is a group of people who aren't feeling that they're scared about catching the virus, then as a group, they're not necessarily going to be taking the actions that we need them to take to get the public health outcomes that we want. So while we don't see them as a group saying that they're that scared though, they still are acting in some ways to protect themselves, but in significantly lesser numbers. So if we have a look over here overall, we see the NatRep, and we see that there has been an absolute increase, in over 70% of people overall are taking measures to protect themselves. We see that the group that's taking the most measures and have been since the beginning is those over 55. And as I was just saying, the males 18 to 34, not as scared and not taking as many measures as the general population to protect themselves. And this data point here is particularly around avoiding crowded public places. And we can see that, you know, from the first wave of the data, we had 3 out of 10 of females over 55 were already avoiding public places. But now that's coming up to almost 9 out of 10. So we would say that the majority of the population of females over 55 are keeping inside, and that's been a significant change over the 2 weeks. Avoiding public crowded places is now the #1 measure which the public is taking to protect themselves from the virus. And that's a change from waves 1 and 2. We would say that waves 1 and 2 was absolutely, hand washing was top of mind for everyone. Hand washing was a measure that people were taking very quickly, improving personal hygiene overall, but specifically around hand washing. We saw that avoiding crowded public places really came into the top 3 in week 2. But now in the most recent wave of data, we see that avoiding crowded places is now a measure that most people are taking. What we're seeing now with avoiding traveling coming in as the 3rd measure that people are taking is that's a different type of measure as well. So where improving your personal hygiene is something that happens on the spot. You wash your hands for a little bit longer. There's not much inconvenience in your personal life in terms of just doing a little bit more hand washing. Avoiding crowded public places, again, that ups the level of a convenience, but it's quite short term. Where we see the change to people avoiding traveling, that to me suggests that people are starting to change their future plans. And it's not just their behavior in the moment that is changing, but they're actually thinking about what happens in the next few weeks. And the avoidance of travel is a outworking of that. So as we said, and throughout the whole piece, the improvement in personal hygiene and the taking personal responsibility and washing your hands more frequently has been at a high level. But that avoiding of crowded places has increased dramatically over the past 2 weeks, and is now the measure that is, or the behavioural change that's being adopted most nationally to protect yourselves and others. And one of the interesting things we've seen, and this is something where our global data is really interesting, a lot of the changes in washing your hands more frequently or increasing your personal hygiene, and then the changes to avoiding public places have developed fairly similarly across the different markets. When we've then gone on to look at some of those other measures that people can take to protect themselves, such as wearing a face mask, we've actually seen quite a difference in some of our other markets. So in the UK, the number of people who are wearing a face mask is still very low, whereas in some of our APAC markets, we saw that from the beginning that was quite high. Now, the advice being given is that the general public shouldn't be wearing surgical face masks or face masks that could be worn by professionals, because we should be reserving those for the people on the front lines who need them. But that advice hasn't necessarily been consistent across all markets. And so what we can see here is that there are different ways that groups are behaving or reacting that is a reflection of their culture, but also that it's a reflection of the advice that they're being given in terms of the measures that it's being encouraged for them to take. So this is something that we're going to keep an eye on here, but we haven't seen the increases in face mask or claimed face mask usage in the UK than we have in other ones. And then I think the flip side of that is that while we had 25% of people when we first went to field for the tracker saying that they were not taking any of the measures that we asked about, this has now dropped to only 4%. So the majority of the population absolutely is taking some type of measure to protect themselves from the coronavirus. Now, the nation's increasing compliance with protective measures also correlates with their perception of how well the government is handling the situation. And we talked a little bit about this when we've been going through the data. We think it's really interesting to see that the biggest increases in approval, which we see from the 20th to the 26th of March, is also when we've seen the biggest increases in the changes of behaviour. And, you know, we think that there is absolutely a correlation between people thinking that the government is doing a good job and people following the advice that they're given as well. There's almost a need for people to believe that the government is doing the right thing right now so that we have them heeding the advice that they're being given. So in the most recent wave, we actually had half of respondents telling us that the government was doing fairly well. And that's a really big change from previous studies that we run. And then while we looked specifically at the NHS, which is something obviously that is really particular to the UK market. Now, the NHS is something that, you know, the population is understandably really proud of generally, but what we've seen over the course of the COVID-19 tracker is that the confidence in the NHS and their ability to respond to the outbreak has really increased. So I know that there's been a lot of grassroots organisation around support for the NHS. There's activities happening around the nation taking time out to thank the NHS by everyone giving them a round of applause. Those activities, while some of them are directed at supporting the NHS and letting NHS frontline workers know that we're there and supporting them, I think it's also contributing to this feeling that we're confident in the NHS, that the NHS is an organisation that we're proud of. That's across all age groups. And again, though, we do see that those that are 55 plus have got the strongest feelings and the strongest confidence around the NHS. And we then went on to ask some questions about when it comes to information about what people should do if they suspect they're infected. We saw that older age group, 85% of those actually felt that they had enough information about what to do in the case of a suspected infection, whether those in the younger age group, so 18 to 24, are more likely to say that they don't have enough information. And that's actually down from 29% in wave 2, so their confidence has increased from wave to wave. But it's interesting that those that feel like they've got enough information are those that are the most confident in the NHS, and those that feel like they don't have enough information are the least confident in the NHS. And so there seems to be a correlation here between feeling like you're well informed and feeling like you're confident that the NHS is going to be able to respond effectively to the outbreak. So that kind of gives us a point of view from the tracker in terms of how the behaviours and how people are feeling about COVID-19 has changed over the last 3 weeks at a high level. And as I said, I think just the overall takeaway from it is that there has been huge behavioural change in the last 2 weeks. And while that behavioural change is something really positive from the perspective of people heeding the advice of the government and taking active steps to protect themselves and others, we're also keen to understand what the impact this is having on wider consumer behaviour. So what we've done is just taken a little bit of a look at some spending data and also at some data around what people are actually spending their money on at the moment to kind of help understand this. probably unsurprisingly, groceries is the only category to see a net increase in spend. So 35% of Brits say that they are spending more on groceries as of March 26. So we've broken it out here by groceries, toiletries, entertainment, and clothing. And we can see that the biggest area that people say that they're spending less on is clothing. When we then go in and actually break that down a little bit more, we can see that while people say on the whole that they're spending more on groceries week on week, we can see that the kind of exponential growth in grocery spend has slowed down. So from the first week of the tracker, we had 13.5% of people saying that they were spending more on their groceries. That grew to almost 31% in the second week of the tracker. And I think when we think about what was happening in the UK at that time, the week of the 19th, there was a lot of stories around panic buying. There was a lot of stories around the supermarkets not being able to keep things on shelves fast enough. And there was a lot of uncertainty about when the government was going to act and when there might be more restrictions put on people's movements. And I think what we think is that uncertainty has led to people spending a lot more in a short period of time. As we moved into the following weeks, response from the supermarkets has been, on the whole, viewed very favourably and quite strong. They've been able to get their shelf packing much more in order. They've got systems in place around letting vulnerable people into shop and home delivery and so on. And so while that spend has slowed down, we actually see that as a positive to really kind of reflect that people are feeling a little bit more in control of the situation, and that kind of need to stockpile and panic buy groceries has dissipated a little bit as messaging has come out that has made people feel a little bit calmer. With everyone having to stay inside a lot more and a lot of restrictions on our movement, we're obviously seeing some changes in how Brits are spending their money online. So in the first week of the tracker, we had almost 80% of people saying that there was no change to how they were spending online. Now only about 40% of people are saying that there's no change to how they're spending online. Interestingly, the biggest growth is actually people who are saying that they are spending less. So it's not that we've shifted all of our bricks and mortar shopping to online, but people's spending patterns are changing overall as a result of what they're seeing. And so we have seen a slight increase in the number of people who said they've spent more, but more than that is the people who are saying that they're spending less. Not on this chart is a group of people who say not applicable, and that group of people has stayed fairly constant throughout, which are those who just don't spend online at all. Those that have increased their online spend, so we're talking just about the group of people who said that they are spending more online than they were previously. We've seen that they're also more likely to be actively avoiding the outside world. So more than 2 in 5 are working from home or avoiding work completely. For those of people who haven't changed their spending, potentially they're people who, for one reason or another, are still having to go out into the world on a day-to-day basis, and so potentially are still doing their shopping in a supermarket and so on. But for those that have, we're seeing that they're more likely to be avoiding crowded public places. They're more likely to be avoiding traveling, public transport, and working from home, going to work. So this absolutely, makes sense. The more time that you're spending in home, you'll have no choice but to shift some of your spend online. And we'll be watching as this develops over time to see if the trend around spending less continues or if people are just moving their spend from one thing to another. There's some questions coming up from those that are intending around increase on other categories such as alcohol, drinks. We've got them in quite big categories to just kind of look at the macro movements between categories, but we do have more detailed information available. If you wanted to get in touch with your YouGov representative, we'd be able to help you out around what kind of data we've actually got that comes down to a more nuanced product category or even to a product overall. So those that are spending more online, most of them are spending on groceries, but they're also spending more on toiletries, entertainment, and clothing. I think the interesting thing here is the entertainment as well. You know, from the previous slide, we see that these are the people who are more concerned about coronavirus, who are curtailing their movements a lot more, but they're not only stockpiling or buying their essentials. People are still spending on entertainment and clothing. It's just not in as bigger amounts. And then in line with the increased grocery spend, we're also seeing, unsurprisingly, an increase in those preparing food at home. The frequency of ordering food in is increasing too, but not quite in the same jumps as preparing food at home is. So we can see that even from the first wave of the tracker, still it was, you know, less than 1 in 10 people who were saying that they were preparing food at home. Now in the third wave of the tracker, we've got 43% of people who are doing that more often. And then when we look at it in a little bit more granularity, so in terms of age groups, we can see that it's the 18 to 34-year-olds who have seen that really significant jump in preparing food at home more often, with 51% of them actually saying in this wave that they're preparing food at home a lot more often than they used to. When we then go on to have a look at how people are ordering in, we can see that again, it's the 18 to 34-year-olds who say that they are ordering delivery more often than they used to. So when we think about, you know, what the impacts are of people staying at home and not going out as much, while it is impacting all age groups in terms of staying in to eat more, we're definitely seeing the 18 to 34-year-olds are having to change their eating and dining habits as a result of staying in more than those other age groups. And then we've just taken a little bit of a look at media consumption. And with everyone at home a lot more, we would expect media consumption to change, but it has actually changed quite significantly. So whilst the majority are searching for news online more often, we're seeing that the watching of TV and movies has seen the largest increase. We're seeing absolutely that brands are responding to this quite quickly. With digital and streaming, they're in a position to be able to, and we're seeing a lot of films that are moving straight to streaming and skipping the theatre. There's also, you know, things like the National Theatre is starting to broadcast or stream every Thursday. So this is an area where brands and other institutions are actually able to make a shift quite quickly. And so while they've got a captive audience and there is that increase in watching TV and movies, we've got people who are ready to kind of step into that and are bringing forward content release schedules to make sure that they really connecting with the audience when they can. And then when we think about then who is actually consuming more news, we can see that in general, people are consuming more, but it is the information hungry millennials who are over-indexing. So those who have grown up very comfortable with online media, who are used to consuming a lot of media through digital channels and online, obviously are quite comfortable with the shift to everything having to happen in that way. And so we can see big increases from wave 1 to wave 3 with the increase of news content and with the increase of movies. And that is across all age groups, but again, it's really highly pronounced in the 18 to 34-year-olds, where again, that restriction on movement has meant a change to a lot of other behaviors, and we're seeing that flow through into consumption of entertainment, takeaway, and at-home behavior in terms of preparing food. So I think that brings us to a little bit of the end of our kind of consumer section. A lot of this data is from our COVID-19 tracker, which we've been running for 3 weeks now. We had another wave in field this week, so that brings us to the halfway point of this particular 8-week block. So if you've got any questions that we didn't actually cover in this section, feel free to follow up with us afterwards, and we will make sure that if able to, we get you answers.
Amelia, thank you very much. If you could now have a look at questions that are coming in on the chat, we'll come back to you at the end. Sarah, coming back to you. Intervening on transmission.
So the anti-transmission behaviors, a vaccine may still be 18 months away from global distribution. That is, according to my latest conversation a few days ago with World Health Organization COVID-19 envoy David Nabarro, who is the co-director of my research unit at Imperial. Now, many of us are home right now because of the policies and interventions being enacted to halt the transmission. Staying home, don't travel. Wide-scale physical distancing has the aim of rapidly suppressing transmission to minimize the number of near-term cases and deaths. Colleagues at Imperial have noted that it is recommended that monitoring the population to test and isolate the identified cases and their household members as rapidly as possible will help reduce onward transmission. In the next slide, we are looking at which countries are doing what. And when looking at Oxford University's policy tracking stringency index, you can see the countries in the world beginning to darken with each successive step that they take with respect to policy and how stringent that policy is. Here you're looking at January, and if we forward to February, you see the countries darken yet again. And then forward to March, you see the countries darken as they take more and more precautions that are more and more stringent. The color, by the way, is not a measure of effectiveness of the measures. So what is most effective? So turning to anti-transmission behavior, the policies, the interventions, researchers at Imperial have produced this estimate of how each policy on its own could broadly affect transmission rates. But you can see clearly here that lockdown is modeled to have the greatest effect. However, you can also see that it is not yet possible to know which other anti-transmission policies have clear superiority over the others. This may be because in the European countries used to model this, the interventions took place so closely together that it remains very difficult to understand which interventions have had what impact. I'm involved with research at Imperial College in collaboration with YouGov, Melanie Lease, and Roberto Crespo to look more closely at these anti-transmission policies and behaviors. There will be many strands of that research, and there will be much more to say about that collaboration in the weeks ahead. But modeling people's actual anti-transmission behavior, what they're actually doing today, with the help of YouGov data, instead of modeling only the theoretical behavior, may help to extend the knowledge about how to use these existing transmission models being used by researchers today. The hope there is that over time, we will understand better which anti-transmission behaviors are the most effective, as well as which ones could potentially be relaxed over time and where. Moving on to testing. According to the World Health Organization, testing and early active contact tracing is key. There's now a presumption among many researchers that many people carry the virus but do not show symptoms. These are the people at the bottom of that case stratification pyramid on my first slide. Since the beginning of this pandemic, researchers have sounded the alarm that without widespread testing, every country is to some degree flying blind. Now, are people complying with health directives? Will they continue to do so if restrictions continue? There are many ways of attempting to answer that question, and one place to start is by looking at some of the evidence about what is known to drive people's health behaviors in particular. The health belief model of health behavior pictured here suggests that key drivers of a positive health behavior, such as stay home, include a person's perception about the severity of COVID-19 illness, a person's perception of their susceptibility to the illness, and that ties back to what Amelia said about fear. It also includes what they perceive as the barriers and benefits of staying home. Factors also include a person's general health motivations. Do they normally look after themselves or not? It also importantly includes the cues from their body or their environment that they receive about the illness, such as symptoms, a dry cough, public health campaigns, such as stay home, save lives, or clapping outside your doorstep, or other cues that I hear constantly and remind me constantly, like ambulance siren. Now, forecasting what happens next. Paramount to all of your businesses is the health and welfare of your employees, your supply chain, and your customers. And everyone on this call, you are in the historically unique and very unenviable position of needing to forecast while taking into account uncertainties that have not previously been relevant to the realm of brands. Factors such as what policies are in place that affect your business, when they are likely to be lifted, how healthy are your employees, your supply chain, your customers. Some of these constraints are out of your hands. Stores and factories are shut. People are home or will be home soon. People are nervous. Many are falling ill. Credit is not loosening up in the banking system quickly enough to ensure supply chains can restart. In much simpler times, I have stood in your business shoes before. Prior to beginning my PhD at Imperial, I was the global marketing director of De Beers when it was part of the LVMH portfolio. I worry all day long, not only about health problems and deaths due to COVID-19, but also about the number of people whose jobs are at risk or who have lost them. And I want all of us to pull together to figure out how we are going to come back from this. I've been asked many times over the past week, how would I account for COVID-19 in forecasting global business? From where I sit, I know that you are doing everything that you can to keep employees employed and to keep them healthy. And to the extent that you're able to, you should include in your forecast model data that you are already no doubt collecting, such as monitoring your customers with usage and attitude data, consumer intention data to decrease uncertainty about rising and falling consumer trends. However, to further decrease uncertainty, you should also consider modeling how the change in virus transmission rates and the eventual decrease in daily cases can predict changes in your local policy and your local market. Policies such as stores being closed and opened again and large public events being allowed. You should consider these factors in your top-down and your bottom-up projections to decrease uncertainty wherever possible. You should aim to do this in a market-by-market fashion, and in the U.S., probably state-by-state, and you should combine these factors in a risk-based scenario. And before I hand it back over to YouGov, it has never before been this paramount that companies collaborate, share information, share business models, new financing models, new supply chain fixes. And I urge each of you to collaborate within and between industries. And I encourage you to stay home and save lives.
Awesome. Thank you very much indeed, Sarah. I think that was a really fascinating insight. Amelia's given you a very detailed view of the UK. What I'd like to do, and that was based on our COVID-19 consumer monitor. What I'd like to do is look at some of YouGov's wider connected data, just to get a feeling not only from the UK, but I'm going to flick into some of the US stuff as well, in terms of what's the mood, and answering some of the questions, looking at hopefully what is around consumer confidence and what might a rebound look like. So back in the summer last year, we started tracking an emotion amongst UK consumers. There's about 20 or so emotions that we track on a regular basis. Throughout the back end of last year, we were trucking along as relatively happy in the UK, and had a sort of a frisson of excitement as we got into Christmas and New Year. But as you can see now, happiness levels have dropped, and we're far more stressed and frustrated than we ever were. But how does that translate, I think, into a key metric around consumer confidence? Because this is where we really start to look at how is this going to impact businesses and its bottom line. So we track every single month in conjunction with the CEBR, consumer confidence in the UK. It's a composite measure made up of questions around household finances, both in the immediate future and over the next 12 months, things around house prices, property value, job security, and business activity. All of the key measures, bar one, is down, and that has reflected in the biggest drop in consumer confidence since the Brexit vote in 2006. The only other biggest one we've seen since we've been tracking this was post Lehman Brothers back in 2008. A crucial audience for many organizations worldwide is the US, and in particular their affluent consumers. So we track on a monthly basis those that earn in excess of $200,000 in the UK. We've been polling them relatively recently with an increase in frequency. And what we can see is that the economic confidence of this group has also taken a hit, not only their view of what the US economy is doing and what it's, how confident they feel about it, but also their personal economy. The latter, I think, being very much linked to those individuals' overall wealth, whether that be in savings or investments or their pension pot. Given the fact that the Dow and the NASDAQ have taken serious hits since the end of February. The Dow has lost over 7,000 points. The NASDAQ has lost a fifth of its value. If we look at spend, so with brand index, what we're able to do is look at how consumers are likely to spend across the next 12 months, or we look into certain categories where we have a slightly tighter time frame. It's no surprise that we see that flights, hotels, and cruises have taken a dip. And what I'm showing here is a weekly rolling average compared to the same week last year. And this is likelihood to spend in that particular category. So flights and hotels, we know and we would expect those to take a hit now given the travel policies in place. But the window that we're looking at here is a 12-month window. So the question in particular is, are you likely to spend or book a flight in the next 12 months? And we have seen a quarter or around a fifth of consumers saying, no, I'm out the category for the moment. That's worrying. For that sector as a whole in terms of what their rebound looks like. But interestingly, we've seen similar dips for clothing and for health and beauty products as well. We can go into that even at brand level for those of you that have brand index, and we can go into that across multiple sectors, but I just pulled out some of the worst hit here. I think what's also interesting is looking at the reputation of organizations. And putting staff and customers first, it does result in a surge in popularity. If you look at some of the stories that have been in the news, and I'm picking out a number of organizations here who've seen, in particular, if you look at the green line, look at Brewdog. Brewdog has turned its distilleries to produce hand sanitizer, for general consumption, and was also attempting to get that into Grampian NHS. They're working together to improve the recipe so that it passed clinical standards, but they're moving in the right direction. They've also set up virtual bars and very much been public in saying we're looking after our staff, and senior execs have taken a pay cut. That results in a surge in their reputation. Whereas if you look at the opposite end of the scale, the pantomime villains, if you like, of the high streets, the media love to run any story about Wetherspoons or Sports Direct. But Mike Ashley saying that his stores were essential goods. 88% of the British public didn't necessarily think so, according to one of our YouGov polls. And they were defying government advice. they saw their reputation fall by 34, or their buzz score on Brand Index fall by 35 points. Weatherspoons, who took a similar aggressive stance, have seen also a similar drop in their buzz. I'm going to pause there because I think I know we're up against time. I'm going to very briefly talk about what's next and then come to Amelia for some questions. In terms of what we're doing, and there was a question from George in the chat about what does the rebound look like. As you can see from our data that we've got using Brand Index and purchase intention, we're able to produce that relatively easily, but we are creating a new economic recovery monitor. That is going into market hopefully next week, and will be across as many of the 26 markets as we could possibly get it, operation as allowing. But in terms of other developments for our suite of solutions, our health compliance monitor, which is being delivered to Imperial, that's been delivered in the last couple of hours. But we're also running a new version of our consumer monitor, as Amelia alluded to earlier. We're updating that, getting rid of things like awareness, and looking at other key measures. So do watch this space for updates on the YouGov suite of solutions. We will, of course, be publishing all of our public data as soon as it becomes available to keep everyone, be you a client, a prospect, or just a member of the population, up to speed with what the latest thinking on COVID-19 is and what the latest consumer reaction is. If you do have any questions immediately after this webinar, please do drop us a line. The email address is info@yougov.com. Alternatively, if you do have if you're a client, please contact your account manager or speak to your YouGov representative. Right, that's enough from me. Let's go to Amelia, who I'm hoping has pulled out some interesting questions.
Thank you, Will. So there's been some really good questions coming through, and a lot of them are around how we can get more granular from the data. One of the questions that came out was around, is there, when we're talking about entertainment, you know, can we be more granular with that? We absolutely can. A couple of just highlights that one of my team, Matt, has pulled out is that what we've actually seen in consideration and intent to listen for commercial radio stations is that in the last month that intent to listen has actually decreased, whereas we're seeing an increase in news lead stations or them at least remaining steady. So, you know, there's things we can kind of tease out from that, is those types of entertainment radio stations are traditionally really popular during commute time, and with commute times no longer part of someone's day, they're not necessarily having the opportunity to listen to the radio in the same way as they did previously, and that's potentially being filled by another type of entertainment. So as Will said, we'll be introducing updated models of the COVID-19 tracker, and we will be looking at how consumer behaviour continues to change over that time. And then what we're really doing is how we can tie that to our pre-existing syndicated data sources to get to that real level of granularity. So any of the questions that kind of came through around, are we able to cut the data by income? Are we able to look at it by different demographic groups? Absolutely. We've told a very kind of nat rep or just some key age group stories today, but there's absolutely the ability to cut that down into more nuanced audiences to get a more granular understanding. So as Will said, either reach out to us on the general line at info, or if you have a particular account manager or client manager that you're working with, speak to them and we'll be able to help you get the most out of the data that you have.
Wonderful. Thank you very much, Amelia. Thank you all very much for joining us this afternoon. Thank you very much to Amelia, UK Head of Data Products, to Sarah Jones from Imperial College London. Thank you all very much for listening. We will come back to you and answer all of your questions that we haven't had time to cover and distribute a copy of these slides. Thank you very much. Do stay safe, do stay at home, do save lives and support the NHS. Thank you very much indeed. Good afternoon.